Well, hi, everyone. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We are back today with another MGMA Business Solutions Podcast, and we have a repeat guest, someone who's been on our show numerous times. That's Dr. Michael Blackman. He's Chief Medical Officer at Greenway Health. And Dr. Blackman is a primary care physician and a healthcare technology leader. Dr. Blackman, welcome back to the show.
Thanks. Pleasure to be here.
I'm just so glad that we enjoyed each other's company enough. So you're back on the show with us. And for this episode, we're going to talk a lot about AI automation, how it's helping provider burnout and helping alleviate some of those pain points in that regard. We're also going to be talking about Greenway Clinical Assist. We'll probably define some of the topics and terms that we're going to be talking about. But first, even though you've been on the show numerous times, what I wanted to do was just have you share a little bit about your background, just in case someone's never heard the shows that you've been on. So if you don't mind just giving us a little bit about that background.
Yeah. So obviously, as you mentioned, I'm the Chief Medical Officer at Greenway Health. I'm a primary care physician by training, trained in both internal medicine and pediatrics. So that sort of gives you, my view of the world a little bit. And despite working now on the technology side for, dare I say, 15 plus years, first as the Chief Medical Information Officer at a health system and then moving over to the vendor side, I'm not the technology guy. I'm one who looks at it and says, okay, what can these tools do for us? How can they make people's lives better? What the technology is, yes, it can be exciting and fun and all of that. But that's truthfully not where my focus is.
Okay. And then for anybody who's listening, these are our medical practice leaders. Most will know Greenway Health. For anybody who doesn't, just share a little bit about Greenway Health and what your role is there.
Yeah. So Greenway Health focuses on the ambulatory space. We are strictly in the ambulatory space, looking at providing, a full set of solutions to ambulatory practices to help them succeed.
You and I and your team shared some information back and forth, so we would really be able to zero in on a particular topic to talk about. So even though, as you said, you're not maybe writing code or anything of that nature, that's not your background, but what I have learned from talking to your team, Greenway really takes a team approach to healthcare technology. Talk a little bit, because you are a leader, so you might not be a quote, tech guy, but you are a leader. And so you understand how important it is to have that team-based approach. Talk about that and how Greenway can help medical practices really embrace that team approach.
Yeah, no, and so we take a team approach not only, in the work we do within Greenway. It takes, it takes a village. We also want to support the team that it takes to run a practice. Mm-hmm. There is no person, whether that be the person at the front desk, a medical assistant, a nurse, a physician, an administrator, anyone else, can run a medical practice on their own and provide good care on their own. It requires that team approach. And so as we build solutions, we want to be certain that we're supporting that entire team, that we're giving people the ability to do the work they do best, to do the most important thing, which is support patients.
Right. Well, thank you for sharing that. So that topic that we're really going to zero in on today is about AI and burnout. I'm sitting with that for a second, because that is a topic that we hear out there. Wow, we've got AI going on, we've got burnout, but we're really trying to look at how we can mesh those together, how AI can alleviate some of those incredible pain points that our clinicians and their support team is going through. Talk about that a little bit.
We've talked about burnout for a long time.
Yeah.
And people have done different things and different approaches. Say, how can you eliminate burnout? You often hear about, people call it different things, but pajama time, people taking work home with them in the evening. Certainly when I was in full-time practice, I don't think we called it pajama time then, but I certainly did. Didn't call it that, but certainly brought stuff home.
Sure.
After I put my kids to bed, you can often find me sitting on the couch calling patients, and patients often be surprised they get a call from me at 8 or 9 o'clock at night. But that's when I had the time to do it, and it was important to catch up with them. AI, and people use the term very broadly, and it can mean a lot of different things.
Right.
But I think it comes down to what are the available tools that can really help. Think about it as an assistant. It's not a replacement, but an assistant. And there are some things that it can, replace in some tasks. Some tasks, it's an additional speed. I use AI tools a lot myself for doing different things. Even for something as simple as if I'm thinking about creating a presentation, I could sit and write an initial draft, and it might take me a while. I can equally take, AI and say, hey, what are the 7 things or 10 things you would talk about on this topic?
Right.
And then edit it from there. I think the point of it being an assistant is critical, especially if we get to other pieces like using AI for clinical decision support. Notice I said the support and not decision making. This still requires, human oversight and paying attention to what you're looking at. AI can still hallucinate in certain situations. So you got to make sure what's being presented is real and makes sense.
You make great points there. And we've talked about that before on this show. And obviously, anyone who's interacted with the different AI tools that are out there, they'll be humming along, and then all of a sudden there's something, just as you said, the hallucination, the just getting things completely wrong. Or if you are looking at, as you were saying, making a presentation, it's not the right tone. It's not really hitting the way you want to address it. So I think what's so important, and this is the point we make a lot here, at least in this day and age, we're not replacing jobs per se, but what we're doing is really giving us, whether it's you, me, physicians, clinicians, anybody else out there, some really important tools. And then we have to use our wisdom, our knowledge, our education base. And it sounds like you've really dealt with that as well.
Yeah, it often comes up. People say, well, is it going to replace people? It's going to cause people to do different things. And I don't know where this quote originated. It's not mine, but I'm going to share it. People talk, oh, will AI replace doctors? And the short answer to that is no. But likely doctors who use AI may replace those who don't.
I love that quote. I mean, not for what it means for people's jobs,
Yeah.
but that's the reality that we're in. And I think the people who really are making that adoption to using the tools and using them wisely are going to be ahead of the ones who aren't. I mean, that's just the clear way to say it. So let's talk about a very specific AI tool. That's the one that Greenway's working with. It's Greenway Clinical Assist. Talk about that, because in the name itself, it's not Greenway Clinical Replace, it's Greenway Clinical Assist. Talk about a little bit about what you see in its usage as a tool and the way that you're seeing administrators and practice leaders using it.
So our vision for Greenway Clinical Assist is just that. It's an assistant that helps you, across the board as you're working your way through any variety of tasks within the practice. The place that it's starting is assisting with documentation. So at its core, it starts with being a ambient documentation solution. So as you're having a conversation with the patient, the system listens to the conversation and then writes a note based on that conversation, leaving in the pertinent medical parts and stripping out other pieces that it doesn't deem are pertinent. Now, going back to the comment I made before, you still need to read your note.
Right.
So you read it, you say, okay, yep, that makes sense. Or wait, it left out something I think is important. And you can then just tell it to put it back in. It's really very, very simple in that regard. But what it does do at its core, though, is it turns documentation from being what has traditionally been an after event, do all the work and now write down everything you did, to being a byproduct of the work you're already doing. So that in itself saves time.
Okay.
And at least, what we've seen with this, both in the literature and in direct conversations with providers, is it also creates, in a lot of cases, a more accurate note. Obviously in the course of a medical visit, you're talking to the patient, thinking about things, and the patient may say something you miss. It's just part of a conversation. when I've had conversations with physicians and others, when they say, well, wait a minute, this showed up in the note, I don't remember that coming up. We go back, we look at the transcript, and sure enough, it's there. And they feel like, wow, I missed that. I missed that comment. So I think that's important. Like one provider in particular said to me, he said, I'm getting to spend more focus on my patient. It's taking me less time, and it's generating a better note. Truthfully, I take any one of those three outcomes, let alone all three.
I would too. I wish I spent 25 years as a reporter, like jotting down notes or recording it and having to go back and transcribe it myself and spend a whole afternoon just typing up the interview. And now you can just get the audio, drop it into one of the different platforms, whatever it might be. And then in a minute or 5 minutes or so, you have the transcription. Now you can really use your analytical skills to decipher what's right, what's wrong in there. So I do want to follow up with you one more question about the product itself. How does it work in practice? Is it embedded in an app, or where is it located and how is it used?
Yeah, so the way we do it, it's embedded in an app. You walk in, start the app, and then just ignore it. Okay. Have a conversation, the usual conversation, usual interaction with the patient. And then when you're done, you simply hit the stop button. It generates the note. You have a chance to review it, and then you press another button, and off it goes right into the electronic health record. Now, I think one of the things that is different about this a little bit is that this may sound sort of obvious, but it can only record things in the note that the system hears. So, what one chooses to vocalize during the course of the visit has to change a little bit if you want that to show up in your note. For example, typically as you're doing the physical exam, you don't necessarily vocalize all of those findings. Right. You would just eventually write them down. But if you want the system to capture it, you have to say things like, what was your heart exam? What was your lung exam? What are your other findings? Now, personally, I think there's some benefit from that, just to conveying that information to the patient. But it's a necessary step if you wanted to do that. If you don't want it to, and you want to put it in later, that's totally up to the user.
And that's a great point, that it actually, hearing you say that, it really increases that patient engagement in the way that you're being very transparent. There are some things you might just jot down. Now you're verbally saying it, they're hearing it. They might even have well, is that a good reading or a bad reading? Tell me more about that. So I think there's a real benefit in actually verbalizing what is being done. So now with your team, y'all shared some metrics with me. I want to make sure I get these right. You shared metrics like 90% report less time pressure and 81% patient satisfaction. I know what the patient satisfaction is. That report less time. What is time pressure? What are we talking about there?
Yeah, time pressure sort of goes back to burnout and back to that pajama time. If you think about the day of a typical, primary care physician, you have a series of appointments back to back, morning session, afternoon session. And yes, it obviously varies by practice and other things, but typically we're talking about, 15-minute appointments, sometimes 30s for physicals, maybe a little less. And so people want to stay on time. People, we've all been to the doctor's office, myself included, where you're sitting there waiting, going, my appointment was an hour ago. Why am I still sitting here?
Right.
So having people given the ability to sort of move through their day a little more efficiently, that's that time pressure. Now, does that mean everybody's going to be on time all day long? No. And I'll speak strictly for myself. Always wanted to make sure I gave everyone the time they needed. And if that meant running a little behind and giving someone more time, that's what I always did. And people, who were late, when I was running late, if they, were concerned about that, and I said, listen, I spent time with someone. If you needed it or your family member needed it, I'd spend time with you. That usually solved the conversation pretty quickly.
Right. The other statistic is 81% patient satisfaction. It's understandable on the surface, but do you have any examples of what's the feedback you're getting? What specifically are the patients seeing, experiencing that they go, this is a better patient experience for me?
Yeah, this is some information we're getting back, either anecdotally or from surveys, we put out afterwards. And it goes back to some of the things we were talking about a second ago, that sort of greater awareness of the patient about what's going on and their involvement and a better chance to ask questions.
Okay. I'm looking at some other notes I have here. We talked a lot about that fear of AI and automation replacing jobs. We talked about it already, but what I would like to talk about now is how do you recommend practices reframe that to their staff so there's not that fear, oh my gosh, we've got the machine coming in and now I'm going to not have a job anymore. How are you reframing that? What is a guideline or best practice to use so it can be used as an upsell to the staff that, hey, this is going to help us all do our jobs better?
I think my first question to people is pretty much, what are you not spending time on that you would like to?
Okay.
What are you not doing that you think would help, either help the practice or help patients, or where you're rushed? And to a person, everyone has an answer to that question. Oh yeah, no. And then the other piece is, what are you doing that you don't think adds value? And so we start looking at those two pieces, saying, okay, what are the things you're doing that are necessary, but you don't think adds value, or where it's not value from you, it becomes more rote? Well, where can we automate those as best we can? And then therefore free you up to spend more time on the things that matter. Everything matters, but an extra conversation with the patient, an extra 2 minutes, whatever it may be, improving that human interaction, and not taking away from it.
With that said, is there data? Do y'all have data yet, either internally or are there other studies out there? You're already talking about, well, we're able to reduce some of that pajama time. What about the time spent in front of the patient? Have you noticed, is it allowing for more time to be on that, specifically on the patient visit, or is there any data on that yet?
We don't have, I haven't seen specific data on that yet, but I mean, but I do think it's a function of it's not just the amount of time,
right,
but it's the quality of the time.
Yeah.
That if you can sit and have that conversation and, really focus on the patient, and especially as we get, further along, as we continue to use AI to help, bring other information to the fore and present things to people, they'll spend less time digging, quote unquote, digging through the chart.
Right. As soon as those words came out of my mouth, I went, quantity may not be the best thing. It could be quality, and it may be how do we define that quality then? Is it having the clinicians better informed? They're not having to dig through a lot of stuff, but it's been because I know when I work with AI, I can have just a couple of bullet points that are summarized, and I now better understand this patient or whatever it is we're doing. Is that how you're defining quality, or what are you looking at there?
I think that's a big piece of it. The other is adding, beyond the summarization capabilities of, search capabilities as well, to make it easy to find the information.
Right.
Certainly if you have a, complicated patient who one has seen for years, there's a tremendous amount of data there. The best sort of corollary I can use here is to think about, the old days before electronic records. So you had something like that, you might have 5 volumes of thick chart you'd stack up on a desk. Well, you didn't read the whole thing. Nobody did. You had it for reference to find, go searching for something. Well, manually searching for something in 5 volumes of paper chart is hard. And that assumes it was filed correctly.
Yeah.
But, electronically, we start having greater capability of pulling things out, or being able to, sort of, Amazon, you asked about this, perhaps you're interested in this, and just bring it to the fore without you asking for it.
Right. That's a really good point. Couple of final questions then before we sign off. I really want to ask you, I know you're not, I'll put the quotes again, tech guy, but you are a leader in healthcare. And so you're understanding the bigger picture of things. Are there some other trends? Are there some other things happening in health IT, healthcare IT right now, in addition to AI, that you might want to share with our listeners?
Yeah, there's a lot going on, as there always is. And I think there are
Right.
probably three things that I would sort of focus on. One is related to AI. And so how do we continue to improve clinical decision support? You know, really leverage the information that's out there, um, you know, moving beyond, simple algorithms, but more complex models to say, hey, did you think about this? And again,
Hmm.
not decision making, but support. Because if you have a constellation of symptoms, maybe to me, I think of five things in the differential diagnosis or three things. Well, maybe there should have been six or seven. And, hey, give me a fuller differential. I may then dismiss some of them or not, or say, so I should look into that further. Why did that show up there, especially in complicated cases? So I think that's one. Um, Obviously, there's risk in all of this. You got to watch for bias in the algorithms and things like that. You want to be sure that, we're within regulatory compliance and all of those kind of fun things. But I think there are real advantages. Second, um, continued increases in virtual care, remote monitoring, and things like
Okay.
that. Things that are a real shift in our, traditional healthcare model, you know, is in the US traditionally, we've had sick insurance. We treat people when they're ill. How do we shift more to keeping people healthy and doing things to keep them out of the hospital? That's
Hmm.
better. Some hospital administrators might not agree with that statement from a financial point of view, but from a health standpoint, we're
Right.
much better off if we can do more of that. And then finally, again, something that's been talked about for a long time is interoperability. How do we continue to share data and information across practices in different places? And TEFCA and some of the other regulatory structures are really starting to come to the fore. We say that, every year or so, but I think we may be finally getting close.
Yeah, all of those are some we could just break off and
Yeah.
start talking about each one of those and have a full episode. But the one that really struck me was the virtual care and how much that is going to be part of our future, because you and
Mhm.
I are in different parts of the country talking now, and we're going to broadcast this and it's going to be published and people are going to see it and listen to it. And so when it's appropriate, should, adopt that as well wherever it can.
Yeah, I think one of the things that's important there is for people to keep in mind that there are plenty of things that can be done remotely,
Hmm.
and there are plenty of things that can't.
Right.
And that, an expectation of, well, they saw me remotely the last time, I should be able to do this remotely true, may or may not be true. And that, we need to use, whether it's AI, decision support, remote monitoring, telehealth, those tools, they're simply tools.
Hmm.
And the users of those tools need to use them appropriately.
I think I need to do some study and just see what the adoption rate is of medical practices, MGMA members who have used AI tools.
Mhm.
Without having that information right in front of me, what I would want to ask you here as a final question: we're here talking about Greenway Clinical Assist. There are other AI tools out there, and it could be overwhelming to someone to go,
Mhm.
okay, we need to get on this ship now so we're not left behind. But at the same time, if they're trying to make decisions, what are the questions they should be asking? What should they be looking for in AI tools to assist them?
I think you sort of start back and say, what problem are you trying to solve?
Okay.
Always a great place to start. What are
Hmm.
the concerns you have about your practice? What are the things you would want to do that you think you can't do today? And what outcomes are you looking for? The next piece is that, right, a hodgepodge of tools isn't necessarily helpful. How do those tools potentially work together? You know, how do you make sure it all works together as a core system? And then equally, look at what you currently have. It's quite possible that what you currently have has more capability than you realize or than one realizes. And you want to make sure you're getting good value from all of those things as you're doing it. I think about myself and, use of something like Microsoft Word. I don't
Right.
know what percentage of features in Microsoft Word I actually use. All I can tell you is that it's small. It has far more capability than I take advantage of. And
Right.
that's often true for the tools that people put into their practices. And they look for a point solution when their core solution already does it.
Great point. So before we leave, then, if people want to get in touch with you or the Greenway team, how would they do that? What are any resources that we can put in the episode show notes?
Yeah. So obviously you can, look at my website, which is greenwayhealth.com.
Okay.
Always send me an email. It's very simple. It's michael.blackman@greenwayhealth.com. I'll respond or get it to the right place. And there are lots of, if we're thinking about, resources about the advent of AI and the use of AI in healthcare, I think there are lots of great resources out there. A couple that I particularly like one is the Stanford Center for Biomedical Informatics. Duke Health also has Duke AI, which I think is pretty good. And then for those interested, sort of a podcast, there's one it's called Creating New Healthcare, which I'm very fond of, hosted by Dr. Zev Newworth, who's done a lot of work in healthcare transformation over the years.
All right. Well, Dr. Blackman, it is so much fun to have you on the show yet again and just connect with you and hear what is going on at Greenway and how you're interacting with those practices out there.
Now, we're looking forward to continuing to make them successful, create healthier communities, and by empowering the patients.
All right. Well, everyone, we will put those links and Dr. Blackman's email address in our episode show notes. We're also going to create an article from this conversation so you can access it in a lot of different ways, either through YouTube, Spotify, and the other podcast platforms, or on the MGMA site to read that article. So until then, thank you all so much for being MGMA podcast listeners.